Welcome back to Family Health Today. I'm Dr. Janette Nesheiwat. As we discussed earlier in the show, lung cancer is the most common form of cancer-related death, with over 1 million people dying from it each year. Well, joining us now to discuss this disease, its treatment, and its prevention is pulmonologist Dr. Jon Sexton. Welcome to the show, Dr. Sexton.
Thank you, Jen.
So lung cancer is on the rise, especially in women. Tell us, why is that?
Well, as you know, a lot of women, starting probably back in the 1950s or maybe even earlier, started smoking. By the 1960s and societal movements at that time, just a lot more women started smoking. And so now, as of 1985, lung cancer became the #1 cancer killer of women in the United States.
Wow, that's just a very, very large number. And it's on the rise, and most of the deaths from lung cancer would be attributed to smoking, would you say? About
90% of most all lung cancers are attributable to the effects of smoking.
So that means it's extremely preventable.
Absolutely.
A very large percentage is preventable.
It's the one largest preventable cause of mortality.
What are some other ways to prevent lung cancer, Dr. Sexton?
Well, certainly, never start smoking in the first place would be #1. Prevention, again, an ounce of prevention is worth a pound of cure. Occupational exposures, you know, if you have a hazardous occupation, you want to take good care to wear your respirators or observe all the rules and regulations, you know, that apply to whatever exposure you may have. You know, just kind of follow the rules.
Tell us, Dr. Sexton, how exactly does smoking lead to lung cancer?
Well, in a lot of people, there seems to be a genetic susceptibility that tends to run in families. If you have a first-line relative who's had a lung cancer and you smoke, or even sometimes if you don't smoke, then there seems to be a higher risk for you to develop cancer. It's usually probably on the basis of just chronic irritation, chronic inflammation that ultimately leads to the cellular changes that leads to the breakdown in DNA and then the change over to a cancerous type cell.
Do you think there are certain parts of the country where lung cancer is more prominent and more common than other parts? Like, for example, the Midwestern states, Arkansas, versus East Coast or the West Coast?
Well, I think that, of course, Arkansas has the 4th highest per capita tobacco use in the nation, and so the tobacco growing states, the southern states where tobacco usage is much higher, then yes, I think you'll see a higher rate.
Sure. Other than, you know, never picking up a cigarette and avoiding smoking, what are some other ways that you would recommend to help prevent getting lung cancer? I know you said that there's a genetic component, so really you can't do anything about that, but what else can one do?
Well, you can certainly modify your risks. I mean, again, if you currently smoke, certainly stopping smoking would be ideal, because it's going to take about 15 years to reduce your risk of cancer to even approach that of a lifelong non-smoker. And even then, it's going to still be higher. You know, I think that good diet, I think diet modifies a lot of things in a lot of ways, and not just for lung cancer. I mean, other types of cancer, especially colon and stuff like that. So I think that occupational exposures, again, you know, limiting your exposure to certain compounds like aromatic hydrocarbons and certain industries that have, you know, lots of exposures.
And, you know, I've read that, you know, if you have a parent who is a smoker, parents say they have 4 children, some studies have shown that at least half of their children may end up becoming smokers as well. Is that correct?
Well, children learn what they see every day, and they think that that's normal behavior, so it's pretty likely that they're going to pick that up. And then they're going to follow in the same footsteps.
What are some of the early signs of someone who's developing lung cancer or has it? What are some of the early signs that they're going to start showing?
Well, unfortunately, there's not really any early signs if you want to think about symptoms. Unfortunately, 75% of people who develop lung cancer present in locally advanced or metastatic disease at the time of their presentation. So by the time you start having symptoms, it's pretty late in the game.
Too late. So I would think the prognosis is poor.
If you look at all comers with lung cancer, the 5-year survival rate is only 16%. Obviously, the stage of presentation is all important, plus the patient's performance status, but it's got a dismal prognosis.
How is lung cancer diagnosed?
Well, early detection would be, the best possible way to find it. Of course, prevention is so much more effective than, even screening techniques. Lots of studies back in the 60s, 70s, they used to do a chest x-ray every year. They've never found that to be helpful. Other studies looked at doing chest x-rays every 6 months along with sputum cytology, and the results were not that much better. It's got to be a serial, ongoing type evaluation. You can't do just one x-ray or one CAT scan once and call it good. It's got to be ongoing.
I see. Is there a certain age group, Dr. Sexton, that you see most people who are being diagnosed with lung cancer? Is it, elderly people or middle-aged?
Most people present somewhere actually starting in their mid-40s on up to about 70. And certainly after that we see a lot of cancers.
It's becoming more common in women than men, is that correct?
Well, half of all lung cancers are now diagnosed in women. Actually, the rate or incidence of death from lung cancer has decreased in men due to decreased smoking up to about 2006.
What treatments are available, Dr. Sexton?
Surgery, obviously, if we can detect it early enough, surgery can be curative. Of course, if we don't detect it early enough, chemotherapy, radiation, combinations of chemotherapy, radiation, and then possibly surgery, depending on the stage and the patient's performance status.
Is there a certain stage where nothing will work, it's just supportive care?
Well, stage 4, the farther it's gone, there are some patients who at presentation really are in such poor shape that they're not going to respond very well.
Those who are candidates for chemo or radiation or surgery, what are some of the side effects of their treatments?
Well, everybody's heard about all the horror stories about hair falling out, but from anemias, bone marrow suppression, nausea, vomiting, neurological effects, whether it's paresthesias, tingling, numbness.
Okay. Have you seen
fatigue?
People that have had chemo, radiation, are they able to carry on with their normal daily activities? Is not very likely.
Well, it depends on what they're receiving in terms of their treatment. Some patients really forge ahead and have a pretty good performance status. They take a fair amount of time off work most of the time.
Yeah. And having lung cancer, does that make you more prone to other illnesses? Especially if you're undergoing radiation and chemotherapy or surgery, you're weakening your immune system.
Correct. Yeah. Sometimes there's been an association. We actually see a higher rate of tuberculosis in some of these patients.
Oh, okay.
But certainly thromboembolic disease, meaning they develop blood clots and potentially infections with a weakened immune system.
Especially if they're bedridden and don't have the energy and strength to move around. I see.
Pneumonia is not uncommon.
I understand. What is the best advice that you would give to our viewers, Dr. Sexton, to just kind of help prevent lung cancer, to take care of their bodies?
Yeah. By far and away, prevention is absolute the best way to avoid this kind of thing. It's the one major modifiable risk that we have in this country is simply never to start smoking, and if you do smoke, quit as soon as you can.
And not just cigarettes, but cigars, marijuana, anything.
There's increased risk of lung cancer in cigar smokers, higher than the non-smoking public, also in pipe smokers, higher risk. Marijuana has not been studied as extensively, but you think about all the various compounds in smoke, it's irritating. It's not meant to be in your airways.
I see. And a lot of people think, oh, cigarette smoking, I'm not going to get lung cancer, but the cigarettes itself, they affect your heart. They're leading cause of heart attacks, one of the leading causes of heart attacks,
Correct.
Heart disease, strokes, high blood pressure. So it's not just that it doesn't just cause cancer, and that's something that we should realize as well.
That's right. If you look at the statistics, about 1 out of every 5 or 6 deaths in the United States can be attributable to the effects of a cigarette.
All right. And on a final note, our governor just passed a bill not too long ago that smoking in the presence of children is now against the law. So we don't want to get caught.
I think that's quite appropriate.
I think that is as well. All right. Is there a place where someone can go and get more information, Dr. Sexton, a website or?
Well, if they go online, of course, they can Google lung cancer. I think the best sites are the National Cancer Institute. Mayo Clinic has a pretty good site. You know, if you look at some of these websites that have a hospital name attached to them, they're going to want you to call them because they're going to advertise a little bit. But I think the National Cancer Institute is a good place to start.
Very good. Well, thank you so much for joining us. We appreciate it.
You're welcome.
All right. Stay tuned. Family Health Today will return in just a moment.